Thank you so much for joining us here on our podcast today. So, welcome to another episode of Plastic Surgery Unplugged. I'm Dr. Raghu Athre, your host, and today we have our guest from joining us from Miami, Florida, Dr. Paul Afrooz. Dr. Afrooz's specialty that he was told me about, and which I'm quite interested in because it's something similar to what I do, is his 4D lift. He is a board certified plastic surgeon trained at the Dallas Plastic Surgery Institute, and has the luck to practice in one of my favorite places in the world. So take it away, Paul.
Oh, thank you, Raghu. It's really a pleasure to be on with you. Thank you so much for having me. I've been looking forward to this and looking forward to our discussion.
Thank
Uh,
you. And by the way, I need to officially apologize because last time I got called out, and so you made you wait. So I apologize. But thanks for taking the time out to join us today.
oh, of course, it's my pleasure. And gosh, I wish I can't even count the number of times that things like that have happened, and I've had to delay meetings. So it's part of what we do. So
Right.
of course, I understand, and I'm happy we're able to make it work today. So a little bit about me. I think we have some our trainings have quite a few similarities. I know you spent quite a bit of time in Dallas as well, and I'm eager to hear a little bit more about your training. I'm sure all the listeners know very well, but it'd be interesting to know where our paths kind of crossed a little bit. But as you said, I'm a board certified plastic surgeon. Um, I trained at the University of Pittsburgh Medical Center. That was a 7-year integrated plastic surgery program. After that, I did a 1-year fellowship in aesthetic plastic surgery, mostly focusing on facial plastic surgery. I moved to Miami and started my practice, and I was doing everything within plastic surgery that I was trained to do. So basically surgery from head to toe. And then I've always knew where my passion was. My passion was really aesthetic surgery of the face, neck, and nose. And with time, I just realized that I wanted to really zero in on my passion. And I've been fortunate enough to do that over the last several years, with a real love for facelift surgery, neck lift surgery, and rhinoplasty, and all the revisions that go along with that. So that's a little bit about me. And yeah, Miami
Cool.
has been wonderful.
Nice. So yeah, I think we chatted a few times off air, and I think we share a lot of thoughts. So one of the things I think that really the first things that made me go, bam, I really want to talk to this guy is we had started talking about mini lifts, and I'm gonna this is going to be kind of interesting. So first of all, I want to hear your kind of the unadulterated. You get to hear Paul say what he wants to say about mini lifts, because you and I both know that you're going to get that patient who calls in and says, "Hey, I really want a mini lift." So, what's your thought process?
Uh, so I really would like to know where that phrase came from, mini lift. I think that it would be interesting to know. If I had to guess, I think it's purely a marketing term.
I agree 100%.
Yeah, because a beautiful facelift that's durable, that's going to stand the test of time, that's going to be a natural result that both myself and my patient can be proud of, is not something I would ever use the term mini in front of. And we can get wrapped up in the vernacular and the words. But the important thing is that a beautiful facelift we can't take shortcuts. And I think that a mini lift somehow suggests that we're taking a shortcut. I a facelift is a spectrum. It's kind of like it's like a volume dial. You know, whether you want a great result, or, I mean, whether someone has a massive amount of aging or just a little bit of premature aging, we've still got to get in there and do some surgical work. And that work, in my hand, involves getting under the SMAS and doing a degree of surgery that's really tailored towards each individual patient. So labeling something a mini lift doesn't make sense to me, because I've always got to get in there and do the work to the SMAS, and in the overwhelming majority of the time, I'm getting under the SMAS and what's currently being referred to as the deep plane. So I am getting in that deep plane, but how much work I need to do in that deep plane really is something that's tailored towards each individual patient. So if I have someone with a great degree of aging in the lower face, a lot of jowling, a lot of laxity in the neck, and they come in asking for a mini lift, or even if it's the person in their early to mid 40s and they're asking for a mini lift, I just don't like to use that terminology, because my facelift is a sub-SMAS facelift, and because I want the results to be durable and long lasting, and we got to get in there and do the work, and how much work is truly dependent on that individual patient. So I don't like to apply labels like mini, because what's the opposite of mini? Is it,
Maxi.
yeah, is it,
No,
yeah,
so you bring up some very interesting points. So I 100% agree with every single thing you said. Now, I further on, I agree with the fact that this whole idea of a mini lift, I think, is completely a marketing term. The first problem I see when someone asks me this, the first problem, we don't know how to define the word mini lift. Okay, there is not a definition that means the same thing to you and the same thing to me. Like when you're telling me my facelift involves a sub SMAS dissection, that is very scientific. I know exactly what you're telling me. Okay. Mini lift doesn't tell me diddly squat. So
yeah,
that's the first thing. So I tell my patients this straight up. It's like that definition doesn't exist. Number two, I really like what you said, that the fact is that it sounds like you're doing less surgery. And I like that from the marketing standpoint. From my standpoint, what I tell them is, I don't know how to define a facelift as if you want to call it a 3/8 facelift, a 15/16 facelift, 24/64. I don't know.
yeah.
Okay.
So where would that cutoff be?
Correct. And so, the further thing that I tell patients is everybody's facelift journey is unique and individual. Okay. You can give me two twins
Mhm.
not getting the same lift.
Yeah. I
Okay.
like,
And so the way I think, and I notice like the guys like you and I who do a lot of facial rejuvenation surgery, and I'm reading more and more of the other guys that are, well, I think we all have the same thought process. It is really a facial rejuvenation blueprint. Like when this person says, I want rejuvenation, then you go, okay, cool. I'm down with the program. What does that rejuvenation entail? And then you kind of make the plan, right? Whether do you need a brow lift? Do you not need a brow lift? Do you need a bleft? Do you not need a bleft? Do you need a facelift? And is that facelift really targeting the mid face and the melolabial area? Or is it more neck? Or is it equivalent mid face and neck? So that journey is independent for every single patient, which is what makes it fun.
yeah, yeah. I agree completely. I mean, there's so much variability. There's so much artistry that goes into it, which is why I don't, uh, there are so many plastic surgery clinics that pop up all over the place, and I'm sure there are great doctors within those clinics that do a lot of high volume surgery. But when it comes to the face, there's so much artistry and variability in, for instance, you mentioned brow lift. I mean, how are we going to, what part of the brow is dropping? You know, what vector are we going to lift that? Are we lifting the tail of the brow? Are we lifting the inner portion of the brow? It's not like you go to McDonald's and you order a Big Mac. If you order a Big Mac from one McDonald's and then you drive 5 miles down the road and you get another Big Mac, chances are they're going to be
Pretty similar.
Yeah, pretty identical. It's facial plastic surgery does not work like that. You are truly in the hands of an artist who is prescribing for you what they believe is going to give you the most beautiful and artistically unique outcome for your face.
And I think what you just said, this is part, it's the amazing truth. But at the same note, it's kind of scary too. I mean, it's the seesaw, right? So for example, if you're Jane Doe on the street and you know nothing, can you say, listen, I don't like this. I want a little, this, they all do that in the mirror. Yeah, I just want a little, okay, great, awesome. Okay. So you go knock on the door of your friendly neighborhood plastic surgeon, okay? And I'm not dogging anybody. So names are odd. Okay. So you go knock on the door.
Discussion.
Pardon?
We're just having an open discussion.
Right, exactly. So this guy says, yeah, I think you need a little facelift action. Okay, cool, awesome, possum. That there, right there, when if that same person comes to see me, that consultation is night and day difference. And patients tell me the same thing, you know. So for example, this is something that rings very true. So after every consultation, I have a little 2-minute post-mortem with my coordinator. Okay. I want feedback. Okay. Most of the time it's feedback on my explanations, because sometimes I can get too scientific and she's like, dude, bring it down, man. Come on. Okay. Yeah. Let's just bring it down. You don't need to go cray.
I get that talk a lot.
Yeah. So recently we had this talk and I saw this lady, she's 40 something years old. She's got a lot of mid-face ptosis. She's got some slight laxity along her neck. And I'm like, cool, I think I can get away with doing just a lift on you, which is a rare thing in my office, right? Because most of the time it's always a little bit of fat, it's a little bit of volume replenishment, it's the stuff. So post-mortem, my coordinator comes to tell me and says, don't ever say that again. Okay? Because you know that every single time you say that, on the day of the OR, you're going to look at her again and go, you know what? I'm going to put some fat in. Okay? So she's like, just go ahead and tell everybody that this is what it is. And if you don't do it, you don't do it. But I will tell you, in a year, it's never going to happen that you don't do it. You will always put a little bit of fat in.
She knows you well.
She knows me well. You know, but this is the thing. It is that artistry, because you get there, you do everything, you go, it would be so much better if ... And then you just got to do what you got to do.
Exactly. So I run into a similar scenario. And so my consultations, I've obviously got to evaluate the patient, and I evaluate them as thoroughly as I can. But part of doing that is really just staring at your patient and staring at them from several different angles. And it's at a certain point, you've got to, you know, it's not, patients get to a certain point where they're like, okay, that's kind of enough staring and analyzing.
Kind of weird.
Yeah, critically analyzing my face. And we laugh about it, and I joke and I say, you know, I'm just going to stare at you for a little bit. You know, try not to mind it too much. But there's a difference between that in-person analysis and that preoperative planning, when I sit down with a patient's photos and I really look in a much more critical means, I'm looking for asymmetry, I'm looking for volume loss, I'm looking for flattening in certain areas. And so it's during that photo evaluation and preoperative planning that I often find myself saying, gosh, I should have mentioned everything to her, because or him, because it does turn out that, yes, I do want to do some fat grafting in this one area that I didn't catch in person, or maybe we should do a buccal fat removal, lower face is really heavy. So I've learned, just like you, to really kind of touch on all those things. And if I have a suspicion that someone may have a hint of something, I will mention that.
Right. So, which brings up the next topic. Okay. So I'm going to call you out. Are you with me still? Okay. Because
Yeah.
you froze for a second. Okay. And me calling you out is me calling myself out as well, because I do the same thing. Okay. So we've come to the basis understanding that facial rejuvenation, like how I say it, it can't be put in a box. Okay, it's not a big box store, right? Every patient's different, every case is different, and it's a continual learning process, and you just get better and better and better and better and better. Now, stating all of this, we're simpatico on everything. Both you and I have a section on the webpage that says mini lift.
Mhm.
Okay? We do it. Okay? So my question to you, I'm going to ask you the question why, and I'm going to answer the same question as well. So go forth.
So it's just become such a popular marketing term that I think that if I didn't do that, I would not have the opportunity to explain to patients what they truly need. And I would be missing an opportunity to really give a patient a beautiful result. And like we just talked about, where does the cutoff for mini end, and what is after mini? I think many patients think that after mini it's full facelift. Those terms to me really don't mean much, but I have that section on the website because I want to be able to discuss this with patients. At the very least, it's great to educate patients and let them know that even though you're not showing signs of tremendous aging, there are still no shortcuts to beautiful results and beautiful facial rejuvenation surgery. And when they come in, I explain to them that it's a spectrum. Some patients need a lot, some patients don't need so much. But I don't like to use the term mini because it implies that there's far less work involved, and that I think that answers your question.
It does. And for fairness sake, I'll tell you, I basically say the same. And I think it really is an opportunity to capture a patient that you otherwise wouldn't capture, to tell them about your practice philosophy.
I agree.
And if they like it, great. If they don't, it wasn't meant to be.
Exactly. And I very much have that similar approach, which is, this is very much a relationship. Like our encounters with our patients, and in speaking with you, I know that you treat it the same. It's a privilege, it's an opportunity, and it's sometimes they're relationships that last many, many years. And
Mhm.
it's not a transactional thing. We have to be on the same page with our patients, and that opportunity to educate them and let them know that what it is that they're searching for can be achieved, but this is how we get there. So that's, I think my philosophy is very much in line with yours.
So I'm going to ask you a question kind of on the same note. So you've already heard my thought. I love fat. Fat is my friend.
Mhm.
So much so that I've kind of really jumped on this idea that I think that almost every facial rejuvenation procedure needs some sort of volume replenishment. Your thoughts, your ideas, because I think this is part of that 4D lift. So, what are your thoughts on this?
I couldn't agree more. I couldn't agree more. Fat has been such a wonderful adjunct to facial rejuvenation surgery. I'd have to say that I include fat in probably 100% of my facelifts, and how much fat I use is highly variable. You know, if it's someone who has not aged with volume loss, or they don't have they have beautiful cheekbones, and then there's always some portion of the face that I think could benefit from, even if it's a drop of fat in the nasolabial folds,
Right.
or what patients commonly refer to as their smile lines. Even if I'm just softening those just a touch to make them look a little less harsh and softer, or whether it's just adding a little bit of contour to the cheeks, or they've got marionette lines, there's always something that, in my opinion, can be softened or made more plush, because just as well as I do, the beautiful youthful face is a plushly padded one. And patients often have the misconception that fat grafting is going to make their face fat, and that is a huge misconception. It's the fat is purely to soften certain deep lines, create a little bit of highlight and contour to certain areas, such as the cheekbones. So in my hands, I fat graft. I would, I'd have to look at my operative reports, but I'm confident in saying that I probably fat graft 100% of patients.
Yeah, it's 100%. I mean, it's gotten so much of a belief, like a postulate, that you almost don't know how to rejuvenate the face without some degree of volume replenishment. Um, do you use all the fractions of fat, or do you do you use the millifat, microfat, nanofat, use all three, or do you stick with only one fraction? What is your thoughts?
So probably two. I use um, macro fat for cheeks, and basically I don't shrink the size of the fat.
Structural.
Yeah, unless I'm doing under the eyes.
Yeah.
And under the eyes, the tear troughs, what I want to achieve with regard to the eyelid is I want a very smooth lid cheek junction. And a lot of times when patients age, they begin to have a line of demarcation between the lower eyelid and the cheek. And in the very youthful, beautiful appearance, we want a very smooth transition from the lower eyelid to the cheek. So that tear trough, or that deep line that creates that boundary of exactly that, peak and valley between the lower eyelid and the cheek, I'm very frequently using um, microfat in that tear trough to bring that to elevate that tear trough and get rid of that deep line of demarcation.
So one of the things I've been doing recently is also using the nanofat component.
Mhm.
And at the very end of the case, micro needling the nanofat component into the
Beautiful.
whole face.
Yeah.
And it's very, so I had a patient of mine who, she's a physician, and she didn't want a facelift. Okay.
Mhm.
She's like, I'm not there yet. I'll be back in a couple years, but I'm just not there yet. So what she really wanted was rejuvenation of the upper one third. So we did a brow lift, we did a blepharoplasty, lower bleph, and volume replenishment over the upper one third with a little bit of volume along the jawline.
Beautiful operation.
It
Yeah.
was fun. And at the very end of it, I did this whole nano fat stem cell mixture microneedling of everything I did. She's like, yeah, I loved all of it. But she goes, I love the way my skin feels. And I'm like, that is the 1% of what we do. But
Yeah.
I don't know what it is, but they just love the way their skin feels.
Yeah.
And I wish I had the balls to biopsy, like do a punch biopsy of the skin before and maybe 6 months after. I mean, I'd love to do it for academic reasons. I mean, you're not going to do it just to do it, but it really would be an interesting, I'd
Isn't it
love to see what the
amazing
results
though?
are.
Isn't it amazing? I mean, it really, it's just that last layer of polish that just pulls everything
Yeah.
together, provides that final luster. And it's really, it's that fourth dimension, it's that one thing that you can't really put your finger on what exactly it is, but it just provides a luster that otherwise is sometimes we just can't achieve.
So recently I saw, who did I see? Patrick Tenard.
Hmm?
Okay. Big fat guy, loves the fat. Okay.
He's
So he
he's
actually,
just to intervene. Ragu said big fat guy. He's actually a very thin, lean guy.
right. He
He is,
understood what I meant. Sorry.
yeah,
Yeah,
he is.
he's super lean.
Yeah, he's very lean, but he's very a big proponent of using fat in all ways.
And he's been talking about this for probably, I'm going to guess, close to 2 decades. And a lot of the studies about fat grafting has been done by him.
Yeah.
And so he had a technique where he's actually injecting fat when he's doing facial rejuvenation into the nose, going through the super tip all the way down to almost the maxillary crest, and inject this column of fat to basically give a little amount of rotation, a little bit of projection, not rhinoplasty projection rotation, but just to offset some of the natural ptosis of the ligaments.
Yeah.
And so I tried it on a couple of cases, and it's funny. Again, you do this humongous surgery, and the only thing that they notice is, oh, I have a cute nose. And you're sitting there going, great, thanks, but what about the rest?
That's so funny. I have a similar, oftentimes, my anesthesia wants to see long-term results of pain
Right.
because, she remembers a lot of the cases and develops a rapport with patients and wants to see their final outcomes. And when I show her before and after, she's always like, did we do a rhino on her? And I'm like, no, but I did put a little bit of fat in, at the radix, and I put a little fat at the columellar
Yeah.
junction right here. And that little bit of fat, it's amazing. It will provide a little bit of projection and provide a little bit of youthful contour to the nose and profile. So yeah, I'm constantly getting that question, hey, did you also do a rhinoplasty here? And but going back to what you said, it's that little bit of fat that can make uh just a very elegant change. And beautiful plastic surgery is that it's the additive effect of all these small things that we do. And yeah, it's in my hands, it's been great.
So do you do most of your cases under local or general?
It really depends. I do rhinoplasties. I will do under general
Of
simply because,
course.
yeah, I really want to protect the airway. We're
Right.
using a lot of irrigation, and patients are laying flat. And when you're using when you've got a lot of fluid draining back there, you want to make sure that the airway is very well.
100%. Facial
Um,
rejuvenation.
Facial rejuvenation, it really depends. It depends on patient preference. A lot of times I'll discuss it with my anesthesia team, and we'll put a package together for each individual patient. But I do facelifts under both general and Mac, and Mac is basically local and sedation.
Okay. IV sedation.
Exactly.
Got it. So, a couple of the things that I've been working on for about a couple of years now, which seems to work very well. So, I do a lot of deep plane lifts under local with oral sedation.
Oh, great.
It's pretty cool. And one of the things that I really have noticed about this is post-operatively, these patients have a fraction of the swelling of general anesthesia patients.
Wow, that's
Yeah.
awesome.
The I think my hypothesis is the oral sedation is mainly just there to make them comfortable during the blocks. Once they're blocked, they don't feel squat.
Yeah,
But the the lack of delta in blood pressure makes a huge difference.
yeah.
Um, there's a guy actually in Istanbul, Dr. Teoman Dogan. He is the guy that does the rhinoplasty thing. Okay.
Hmm.
So I've read a lot of stuff. I actually went to go meet the guy. I've known the guy. He's awesome. He's a good thinker. I love
Great thinker and great educator.
great thinker. Love the way he thinks. And so he does only rhinoplasty at this point. He doesn't do anything else. And so what he actually does is to minimize that delta in the rhinoplasty. So he injects the nose. So once he injects the nose, literally he puts a stopwatch for 30 minutes. 30 minutes of doing absolute zero. Okay? It's a really hard thing to do. Like when you're in the operating room with him, he actually has to physically leave the operating room because he's like, if I'm there, I'm going to start.
Yeah,
And by doing that, he goes, I'll show you. And you look at the blood pressure tracing, the anesthesia is really set in. Like that delta is so small
yeah,
that there's very little bruising. It really has changed the amount of post-operative bruising and swelling.
yeah. That's awesome. I I I guess I sort of know that in the back of my head. So I have timed my injection and all the other things I do in preparing a patient. And I'm very much involved in that. Um, I'm very obsessive and
I think
about
we all are.
yeah. So I will inject my patients. Then it's a regional perinasal block, and then I'll do a lot of things. I'll trim the nasal hair, which some surgeons do, some don't. I prefer to just trim it and have a nice clean field. So I'll trim the nasal hair. Ever since COVID, I started prepping the inside of the nose with betadine. So I'll trim the nasal hair. This is all after I've injected. Prep the inside of the nose with betadine. Put my pledgets in with oxymetazoline to get some vasoconstriction on the inside of the nose. And then I go and scrub, and by that time, the patient's prepped and draped. And I bet if I were to time that all out, it's definitely going to be 30 minutes, which is great because that's really the peak of when that local is setting in
Right.
and patients are very comfortable. And we've really tried to cut back as all surgeons have, and I know you doing the same. We're really trying to cut back on the amount of narcotics used during surgeries because patients wake up nauseated with the narcotics, and if we can avoid it, we certainly love to do that.
Right. Um, the one thing that I love about facial rejuvenation, especially when you do, like my nickname for it, just colloquially, I call it full facial rejuvenation because it's never just a single isolated procedure. It's always some combination, right? It's like
Of
you have a
course.
toolbox and you're pulling tools out of it. And so I love the idea of how to put them in a sequential order. So
Oh yeah, it's like a symphony.
it is.
And that's what's so much fun about
It
what we
is.
like when you decide what your combination is going to be, when you decide in your preoperative planning, the day of surgery is really about executing a well-formulated plan. It's not the time to think about, well, hey, how am I going to do this? So
Right.
a perfect example of what you just mentioned is if I'm doing a brow lift, upper bleph, lower bleph, face and neck, I really got to think about how what's the sequence going to be? When am I going to stop the face and inject the brow because I know I'm going to be getting to the brow? And if you're good at that, which takes experience, if you're good at that, the surgery goes along like a
Just
beautiful.
one after another I mean, it's just it's so smooth.
Yeah, exactly. And those are the types of things that come with experience.
Right. And the other person, I think you'll agree, the other person who rarely gets credit in this is your tech and your team, right? Because when they know your generalized, like we actually sit down 2 days before every case and we drop the game plan, right? And I just write down the game plan, like what time the patient's coming and the anticipated time of every single thing, down to like, you know, start right bleph at this point, inject other side, come back. So I mean, and they know this, they've done it so many times that it's, you don't even have to talk,
Yeah,
you're
yeah,
just like, you know,
that's
it's
awesome. So, do you ever get the question from patients? And I really don't blame patients for asking this, but do you ever get the question, why don't we do this in a hospital?
I do.
And what do you tell them? I think this is a
So
good segue into that frequently.
so that option definitely exists for you. Okay. So the way I explain anesthesia and stuff to them is as follows. Okay. So first of all, depending on the procedure we're going to do and your concurrent health history, first dictates the type of anesthesia we're going to do. So, for example, if we're going to do a rhinoplasty, by definition, we're doing general anesthesia. So that right there is the basis point, and that dictates where this thing can be done and how it needs to be done. So that's option one. Okay. Now, so let's say we're going to do local anesthesia. Okay. You can still do local anesthesia at a hospital. Absolutely, that choice is yours. I've had a patient that I insisted that her local anesthesia case was at the hospital. She is a kidney transplant recipient patient. She can have all the medical clearance in the world. We are not doing that in my office. It doesn't matter to me. Like, if you want me to do surgery, these are the stipulations. And so the decisions of where we do surgery are based on safety, patient past medical history, patient comfort, and then finally, my recommendation in that order. Now, so for example, doing it at an outside facility other than the hospital, there's some significant advantages. A, let's be honest, cost is an advantage to the patient. You get my team, okay? That is the biggest advantage of all.
That
They
that
know
that's
how
what
I
I'm.
do it every single time. And then number three is that if the case is of low acuity, okay, I mean, I'm not doing a heart transplant, okay, then this is a very safe way to do this.
Yeah.
Now, if again, kidney transplant patient, yes, her doctor said it's okay to do it at an outside facility. I'm not taking that risk.
Yeah. Yeah, I like that. My explanation to patients, obviously, it's a case by case basis, and if someone's got significant past medical history or um, uh, other health problems, we're obviously going to be looking into that in much further detail, and if it needs to be done at a hospital, then so be it. But what I tell patients is, um, you know, you can't take a Michelin star chef out of his kitchen and ask him to do good work, because he's got his entire team in there that knows how he wants things done.
Right.
And that's what we would not be getting at the hospital. There's a good chance I would be meeting the team for the first time. There's a good chance they've never seen the procedure done the way I do it. And it introduces so much variability and so much potential frustration that it's really, in my opinion, aesthetic surgery, when it can be done um, in an ambulatory facility such as you mentioned, then I think it's much more conducive to the type of results that we're after.
It's optimal. I mean, I think you make excellent points, and I'm going to add to that the vast majority of hospital. We go back to the first thing we said, where you can't go to two different guys to McDonald's and get a hamburger, right? So if I do a facelift and you do a facelift, we're doing it differently. Let's be real about this. And if you're taking out an appendix, quite frankly, it doesn't really matter. Okay. And so hospitals are trained with the appendix model. They're not trained with the aesthetic surgery model.
Of course. Yeah.
And like, for example, simple things like instruments. When we go to the hospital, we actually bring all of our own instruments. It's a pain in the bloody tuchus.
Yeah.
But I cannot use their instruments.
I mean, that's torture.
It is.
Torture. I mean, the amount of thought that I've put into each and every one of my instruments, down to the last pickup or hook or
right.
And to assume that the facelift set in the hospital is going to have that degree of thought put into it, I mean, that's just simply not the case.
So we found this guy. So some of the instruments that I've gotten accustomed to, some of the big manufacturers don't make some of this stuff anymore. And you get used to it. It fits in your hand. You like the way it feels. The distance between where the hook goes over your hand and the claw portion is perfect.
Yep.
Okay. And you just get used to it. So we found this guy. He has a place in Pakistan, and he makes instruments. So there's instruments that I send him the instrument. Go, this is the last one I have. This is and he duplicates it.
Oh, that's incredible! I'll have to get his info.
He's awesome. I mean, and like, because some of these instruments have been given to me by my fellowship director. I'm used to that thing, and I don't know how to survive without it.
Yeah. It's so funny because I'm very much the same way.
It's like teaching an old dog new tricks, right? You become so accustomed to this thing, and when you don't have it, it's like it first of all puts you in a bad mood.
Yeah.
And then once you're in a bad mood, it's downhill from there.
Yeah, exactly. So it's to give you an example, a lot of knife handles are, and this is not to knock anyone that uses whatever type of knife handle you like, but I use a round knife handle because
yes,
I have so much precision and control.
The pencil looking knife handle.
Exactly.
And when you go to the hospital, 99% of techs will tell you they have never seen that knife handle before.
Yeah.
Yeah.
So that's just one example. And I've hand chosen every scissor I use for my facelifts, and
yep. Needle drivers. Okay. Something as simple. I mean, whether it has cross hatching on the teeth or it is flat. I mean, there's a reason why it has that.
Yeah. And I have both in my facelift set for certain sizes of suture. And it's interesting. I had a patient once who somehow she kind of got wind of how obsessive I was about my facelift instruments. and she is a sommelier, and she, as a gift, got me a wine bottle opener that has a lot of history, and the wood and the metal are all very unique. And she explained to me how this is what she prefers. She likes the way it feels in her hands, and each bottle of wine is so special, and she loves to have that control and that feel over it. And it was very ironic, because it's exactly the way I feel about my instruments.
Yeah. And it's nothing that, okay, the actual cost of the instrument is not, it's not super valuable.
Yeah.
Okay. But when you see somebody who isn't part of your team handling that, and they put it in the washing machine and they just throw it in the tray, it's like, it's like amputating portions of me without anesthesia.
I mean, just the sound, like everyone knows that I'm listening. If instruments are being handled roughly, it's I'm gonna have an objection to that.
Yeah. But it's I think it's kind of like, it's like the, what is it called, the beautiful sport, right? So there's a movie, I know you probably know who Pele is, the soccer player. There's a biography, I think it's on Apple TV. It's called Pele, and it's a story about his life. And he came from absolutely nothing, and he ended up playing for Brazil for the finals of the World Cup, and he's 17 years old. Okay. And he was so nervous. He actually, when he found out that he's going to go play, that he's puking in the toilet because he's never played on that stage before. He's 17. And so it's called, this guy had an inordinate skill. He was an artist at soccer, and so therefore it's called the beautiful sport, because he managed to do things with that ball that it's unimaginable. And it's kind of the same thing, right? You pick your craft and you say, I'm going to be the best in this craft. And you put as much energy, whatever you have, into it. And every little piece of that craft fits together.
Yeah.
And it's a
And
story.
it's so we get this tunnel vision, and we're lucky. We're very lucky that we love what we do, but we're just so engrossed in what we do, and we're lucky because there's so many rewards that come as a result of loving what we do. I mean, we really get to impart big changes in people's quality of life, and among so many other things. And for me, that's the greatest reward, is that I'm doing what I love to do, and I've put my heart and all my passion into this. And yeah, we make a good living, but it's truly that transformation and that sparkle in someone's eyes, and their newfound confidence in the way that they carry themselves, and the change in their posture and demeanor after this. There is nothing more rewarding than that.
Absolutely. I mean, it's the compensation financially is number 175 on the.
I agree. And we make a good living. Let's not,
I'm
let's
not
not
complaining.
yeah. But there are other ways to make a living without 2 decades of schooling, and
It's not even the schooling. It's not any of that. It is, that when that person just says thank you, okay, or they give you that smile, like, oh my God, it looks amazing.
yeah.
There is no. It's like, for everything else, there's MasterCard. I mean, it really is. I mean, there's nothing that
Love
compensates,
that.
and we live you know, so I'm a dog fanatic, right? And so I have two golden retrievers.
Huh?
Okay. In reality, we're golden retrievers. We live for that pat on the head.
Yeah.
That is what makes it.
Yeah. Speaking of which, this is my buddy
Oh,
right here.
nice.
Yeah, this is Santino. He's my buddy. And
Yeah.
um, he's a French bulldog, and we actually do all of our operative planning together. So,
So Jersey, she's downstairs. So Jersey is my golden retriever. She comes to the office when we have pediatric patients.
oh yeah,
Yeah, so if we have a PD patient for, sutures, whatever, she's the one, she'll jump up on the OR bed and they can hold her like a teddy bear.
that's awesome.
Yeah.
That's
It really it cuts down on the stress.
100%. And so, like we were talking about earlier, a good operation, a good surgery is execution of a very well thought out plan. And for me, that happens at night on the couch with my dog
Right.
in front of the computer. So
Yeah.
uh, when I'm chatting with patients, I frequently tell them that, we'll see what Santino, my dog, says about your operative plan.
Right. It's true. Well, I really appreciate you joining me and giving me an hour of your time. I don't want to take too much of your evening off and let you get back to your family. So, to all of our listening public, I'd really like to thank Dr. Paula Afrooz from Miami, Florida, for joining us. You wasted another hour of your time listening to our views on facial rejuvenation and everything else. Um, Now, one of the things, go
I want
ahead.
to say thank you so much for having me. I think it really has been a lot of fun chatting with you. I think
Thank
we
you.
are such like-minded individuals, just dedicated to obsessively dedicated to our craft, and I really appreciate that about you. And thank you for having me. And this was a lot of fun.
Thanks, Paul. So, mi casa is su casa. So,
Yeah.
if you're down in Houston, please come on by.
Likewise.
Thank you.
Do you come to Miami?
I do. I do at least a couple times a year. So, next time I come in, I'll definitely hit you up in advance.
I would love that. Yeah, we'll have lunch or dinner, and I'll show you around a little bit. I'm sure you know your way around, but maybe some hidden gems.
Awesome. Sounds amazing. So, thank you for joining us. To everyone out there, it's another episode of Plastic Surgery Unplugged. Please hit the subscribe button. Down in the details and comment section, I will include all of Dr. Afrooz's contact information. Please do not hesitate to contact any of us regarding anything you heard about the show. You got questions, concerns, anything. Even if you send it to me, I will forward it to Dr. Afrooz. So I appreciate everybody listening. And most of all, thank you, Paul. I appreciate it.
Thank you, Raghu. Have a great night. Once again, it was a pleasure.
Thank you so much.
Well.
Bye bye.